This is the home of Awanslivia Nalwoa. The mother of two was found drunk and weak very early in the morning. Nalwoa and her husband have grown tobacco for the last 3 years, but nothing has been earned from it. Her house also serves as the store for tobacco, and the grass-thatched structure in her compound is where she hangs it to dry. However, storing tobacco in the house poses a big health risk to her life and that of her family. She is, however, not bothered. She prioritizes money compared to her health. Stephen Mlondo in Sebunyonyi village is another. Tobacco growing is what puts food on the table for 6 years now. It is from this that he is able to pay fees for his children. Mlondo is, however, willing to abandon tobacco growing if government provides an alternative livelihood. He cited exploitation by BAT, the company which buys tobacco, yet its cultivation takes about a year. The many health hazards affecting these farmers prompted Joyce Ntwetwe to abandon tobacco growing. Today, Ntwetwe grows food crops and now lives a healthy life. Cigarette smoking is an addictive practice, yet its implications are enormous, especially to the life of a smoker. Most of these tobacco growers smoke and take warrage, which puts their lives in more danger. David Mayengo, the in charge of Ntwetwe Health Center 4, noted that this area is hit with tuberculosis in addition to the high HIV prevalence rate.
The prevalence of HIV in our area is high. Hence, the catchment area for TB is also prevailing at a high rate. Basically, the major challenge in terms of TB that we face around this area is in terms of follow-up and management of patients. The patients do come around and we do manage them, but when they leave us, if we happen not to get back in touch with them, then they are lost.
The coordinator for Center for Health, Human Rights and Development Organization, funded by United Nations Development Program, Thraya Mpanga, noted that without any delay, government needs to consider passing the Tobacco Control Bill into a law to protect the lives of people, especially those who are already vulnerable to HIV/AIDS.
HIV people are being hastened by tobacco growing. Since we all know that tobacco is associated with the non-communicable diseases of cancer and the likes, cancer, respiratory diseases, we realize that people who are growing tobacco, their chances of living is reduced. So we are saying that we need the tobacco control bill so that we can implement what the 1995 Constitution of Uganda stipulates in the aspect of Bill of Rights.
The tobacco bill seeks to fulfill Uganda's international obligation on regulation of tobacco consumption.